This is our non-invasive ventilation mask line. It has many characteristics that outweigh the competition. The first thing is that everything is made of silicone, including the forehead piece. Some of our competition has a foam forehead piece, which is fine in the beginning, but eventually the patient's going to sweat. Foam gets sweaty, gross, can't really clean it. This can cause skin breakdown on the forehead. Ours you can wipe clean. Our forehead piece also adjusts more than any other mask on the market. We have a unique feature called the Omni Clip. When you squeeze it, it can adjust both up, down, and in and out. Some of our competition does have a adjustable forehead piece. However, it only adjusts on a crescent shape. That's good and great. However, if you want to get the forehead piece in this position or this position to alleviate pressure on the bridge of the nose, you cannot do it. We have a dual lip cushion as well. Allows a mask to float on the patient's face. Our clipping mechanism is easier to use than the competition. Simply twist, it'll snap off and secure it into place. Some of the competition has a ball and socket type mechanism, which is very difficult for the staff to secure into the mask. For no upcharge, you can also adjust the clips to the proper position, remove them, and tilt the mask up 90 degrees on the patient's face. This allows you to have the patient take a glass of water, receive some meds, etc. And it also causes less of a need for your RT staff to go down and resize a mask every single time that the patient wants to take a drink of water. Nursing staff could do this, for instance. We also have interchangeable elbows. The reason for interchangeable elbows is the majority of the time a patient uses this mask on either a Vision or V60, a bi-level machine. In that case, you would use a clear anti-asphyxia elbow. When you open up the mask, this will be packaged in a clear little plastic baggie. Simply remove it, take it, it's a friction fit, push it as far as you can into the mask. It has an official shelf, so it does have a stopping point. No other mask manufacturer has a stopping point for interchangeable elbows. So this makes sure that you have a secure fit. Elbows are not going to pop out if you don't push it in far enough, or you're not going to have a very difficult time removing it if you push it in too far. So take it, push it until the elbow and the fitting is flush, and you're good to go. Use a blue elbow for whenever you want to use this on a standard ventilator with a dual limb circuit. And again, have the mask package with the clear anti-asphyxia elbow. Have a little box of 10 of these sitting on your shelf. Saves shelf space, time. The mask can follow a patient to different machines. If they're on a V60 and you want to switch them over to a ventilator, you just simply do an elbow swap. This is our Max Shield line. It's getting very popular in the US. Reason being, it helps alleviate skin breakdown, especially on the patient's bridge of the nose. Nowadays, facilities are putting patients on non-invasive ventilation, bi-level ventilation for much longer periods of time. So if you have a patient with a mask on their face for, say, 5 days, that patient's very sick, their skin is going to get red, especially on the bridge of the nose. It's the way the body reacts. So what you do is you use this as an alternating strategy, and it gives the skin a chance to rest.